Good morning, everyone. Thank you for joining our webinar on the coronavirus, so COVID-19. Just a bit of housekeeping before we get started. This is a broadcast, so we are unable to hear any questions or any audio that you have. So today we're going to do quite a lot of Q&As, but if you try and ask the questions through the webinar, we're unable to hear. What I have got is a slide explaining exactly how you can ask any questions that you've got throughout the webinar, and hopefully we'll get them answered at the end of the session. Hopefully you can all see my screen. In terms of timing, we've got this booked in for half an hour, so it should be ending at 10:30. Now, this is the fourth webinar that we've had in a row each week. So, and each time we tend to go over slightly. So if you are able to stay on the line, then great. If you have to drop off, then don't worry, we're recording the session. What we'll do is post-webinar, we'll get the recording out to you so you won't miss anything. In terms of the structure of today, so if I just move on to the agenda. So we're going to go through just some of the latest guidance because this is changing on a daily basis. So we're just going to go through a bit of an update on that, update on statutory sick pay, update on business continuity, obviously following the latest announcements from the government. And then we're going to leave quite a lot of time for some of your questions. So hopefully we'll get them answered. I'll introduce them a bit more formally today on a later slide, but on the webinar from MorePay today, we've got Michelle, who's our HR Services Director. We've got Phil, who heads up our health and safety team, and we've got Audrey, who heads up our HR consultancy team. So hopefully they'll be able to answer any questions you've got throughout the webinar today. If you do want to ask any questions, there's a question box on the GoToWebinar control panel. If you put a question in there, we'll be able to see it. As we've found with past webinars, we've been inundated with questions. We've not managed to get through them all. What we will be able to see is who's asked the question, and we can. What we have been doing is getting back to whether it be prospects or customers, whoever's on the webinar asking the question. We'll get back to you with an answer from one of our experts. When I ask any of the questions on here, I'm not going to say who's asked them, so don't feel like you're going to be be pointed out. I'll make sure I don't mention any names. I'll just be going through the questions. So that's how to ask any questions today on the webinar. Because we have got some prospects on here as well as customers, I've just literally got one slide just to give a brief overview, very top level, of who MorePay are. So we are been going over this year will be 54 years old. 10,000 customers, and you'll see some of the logos at the bottom, some of the businesses that we work for. We process around 500,000 pay slips every month, handle around 12,500 payroll and HR queries each month, and together with our parent company Zealous, formerly NGA Human Resources, we pay 1 in 6 of the UK working population. So hopefully that just gives you a top level overview of the business, who we are. Our product portfolio is built up of payroll HR software wrapped with payroll and HR services, and that also includes health and safety services. So if you want to outsource any elements of your payroll HR, you can do that through MorePay, or if you want to just use our software, you can do that as well. So I just wanted to just go through that slide just to give you a bit of an update for anybody that's new to these webinar series. I just wanted to give you an update as to an introduction into who MorePay are. So the presenters that we've got today that are going to go through the next few slides and then answer the questions at the end. So we've got Michelle Hobson. She's our HR Services Director. She joined MorePay in 2017. 15 plus years of both operational and strategic HR experience, and fully CIPD qualified. Then we've got Phil Barker. He heads up our health and safety team here at MorePay. He joined in 2008. He's got 20 plus years in experience in both occupational safety, food safety and compliance. and he's also a chartered member of the Institute of Occupational Health and Safety. And then we have, and I mentioned before, we've got Audrey Roberts, who heads up our HR consultancy. We've asked Audrey to join today, and she's going to go through a bit around employee wellbeing. It's coming through on our advice line, and we also know that businesses need to take a bit of a proactive approach around wellbeing, especially in these uncertain times. Whether they're working from home or working in the office, their wellbeing needs to be looked after. So Audrey's got a bit of guidance around that. So I'm going to hand over firstly to Michelle, who's going to take us through the updated stats. So over to you, Michelle.
Thank you, Dan, and thanks all for joining today. I think life is very different to what it was a week ago when we did the last webinar. Things have moved on in terms of advice and guidance, and it has become much more serious as the virus has progressed. And I think we're all facing, as I said, a very different time to what we were a week ago, whether that's the impending closure of your business, it may have already closed, and wondering what to do about the new government retention scheme, or you may be like me, working from home and trying to balance homeschooling with 2 children. Things are very different today. But just to go through some of the current stats again, as of 9 AM on the 23rd of March, there was nearly 84,000 people who'd been tested for COVID-19, and around 77,300 had tested negative. But what that meant is that there were 6,650 confirmed cases and 335 deaths. And the risk to the UK, as declared by the government, is high. Most of you will know what the symptoms are to look out for now, but it's always worthwhile reviewing them. And these are symptoms that usually develop within 14 days after exposure. The main ones are coughing and fever, but also difficulty in breathing. Along with all the government measures that have been put in place over the last few days, one of the main ones still remembers the hygiene piece around washing hands and how easily this virus spreads. I think, though, if we could take comfort from something, and whilst it is slightly too early to say, Italy for the last 2 days have reported a slight downturn both in the number of cases and the number of daily deaths. Now, they were hoping that the measures that they put in place 2 weeks ago, that within 2 to 3 weeks they would start to see a downturn. This has happened. I think everyone is treating that with some caution, but fingers crossed that goes in the right direction and is something that the UK can learn from. So if I just go on to the next slide then. The government update, and these were the updates that were given on the 20th and 22nd of March. I will come on to the Prime Minister's announcement last night shortly. But on the 20th and 22nd of March, pubs, clubs, bars and restaurants closed as of Friday the 20th of March. Gyms, leisure facilities, cinemas and theatres closed as of the same day. The self-isolation rules remained in place, that you're to stay at home for 7 days if you think you have your symptoms, for 14 days if anyone in your household has one of the symptoms, which is a new continuous cough or a high temperature. The government announced a number of schemes to help businesses through this, and the biggest one that has an implication is the announcement of the job retention scheme related to COVID-19, which is support businesses by paying up to 80% of an employee's salary who would have otherwise been laid off due to the coronavirus outbreak. And I will talk a little bit more about that in the next slide. And then as of the 22nd of March, we were informed that around 1.5 million people will be written to by the NHS this week to inform them of their need to self-isolate for 12 weeks. These are people who are described as extremely vulnerable, and the link on the page there takes you to the specific information about what is classed as extremely vulnerable. I think most people in these categories will already know that a letter is coming to them. If they are people who are employed, then they will be eligible for SSP from day one, where they meet the right criteria for SSP. I think the thing to remember with the graph just in the top right-hand corner is that what the government are doing here is trying to flatten that curve of spread. The NHS cannot cope if it had gone on the same trajectory as it would have done with no action, and they are trying to flatten that that spread by putting all these extreme measures in place to deal with it. So on the next slide then, if we just move on. Sorry, I think it's frozen. There we go. Just want to talk a little bit more about the job retention scheme. As you can imagine, our advice line on HR has been extremely busy since Friday. It's been busy over the last week, but with the announcement of the job retention scheme, we have a lot of our customers asking what this means for them, how they can access it, and how they go about it. So to summarise here at a high level, your business can apply for a grant from the government job retention scheme to pay part of your employee's salary where they would have otherwise been laid off. It applies to all UK businesses, and the government will grant 80% of an individual's salary up to a maximum of £2,500 a month. To do this, you need to change your worker status to be furloughed workers, and these are employees who remain on the payroll but are not required to work. So we'd already had a lot of customers asking us how to help them with temporary layoff of staff. This is an alternative for this, where you can keep them on the payroll, they're not required to work, and then you can apply through the scheme. You need to notify your employees in writing, and this can be as per your contract or subject to a consultation. And for our customers, we have template letters that can help on all of this. We have put a frequently asked questions document on the MorePay website, which I'd encourage you to visit, on the Knowledge Centre on COVID-19, which should help as well. So businesses will be able to apply for this government grant through a new HMRC online portal, which is being currently built. The first set payments are expected within weeks, but we do not have a definitive answer on when and how this will be, other than we know payments can be backdated to the 1st of March. And our advice to everyone is, if you have already laid off staff or made people redundant, you can change their status to furloughed workers if you engage with them as soon as possible. But if you made a decision before this announcement was made, you will be allowed to go back on that decision and change their status, so that you can temporarily put them on this new worker status, and then when the situation upturns and things stabilise, that they can come back to work. And then the final slide I just wanted to cover was in light of the government update as of the 23rd of March. So at 8:30 last night, the Prime Minister announced some more stringent measures in place. We were asked for everybody to stay at home unless for one of the 4 reasons below: shopping for basic necessities as infrequently as possible, 1 form of exercise a day, for example, a run, walk or cycle, and these must be taken alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and then travelling to and from work, but only where this is absolutely necessary and cannot be done from home. The government did release a document later last night with further information about the exceptions and which businesses that they covered, and you can find this online. There is still an air of uncertainty, I think it's fair to say, about what that final point means, travelling to and from work where this is absolutely necessary. We'd advise you to read all the documentation you can, and as we get clarification on the interpretation of that, we will make sure that we update our details accordingly. But again, all these measures have been put in place with the specific aim of flattening that curve and slowing the spread of this virus down. So on to the next slide then, and I am going to hand over, I think it's to Phil next.
It is, thank you for that, Michelle. This is probably less of an important point than it was before the Prime Minister's announcement yesterday. This is about keeping businesses running safely where you can't work from home. Obviously, that applies to less businesses today than it did yesterday. But moving forward, what we need to consider is when the government starts to relax these rules, and the Prime Minister said they'd be reviewed in 3 weeks, that the coronavirus is still going to be with us. It's still going to be with us for 18 months-ish. Until the UK population builds up its immunity and the government are really just trying to slow down the spread in a manageable format. So we still need to think about some of these, running your business safely once we're back to working in our offices, working in our shops and restaurants. So what do we need to do? It's risk assessments, and we have a draft risk assessment available for our clients. We're updating that on a regular basis. Government guidance changes. So if you downloaded the template a week ago, it's worth going back and having a look at the new template, because we'll have updated that in line with the updated government guidelines. So yeah, first thing to do is risk assessments. Are you currently doing enough to protect your staff that are still at work? Do your staff know the symptoms? Do they know what they are? Do your managers know what to look for to think about sending people home? What do you do if someone does develop the symptoms? Do your managers know the routine? Spot the obvious typo there. Travel arrangements. Do you need to review your travel arrangements? People coming into work, car sharing schemes, things like that. We need to limit the spread of the limit the spread of the coronavirus within the workplace. So have we got the suitable cleaning facilities in place? Are our cleaning contracts adequate? Do we have access to the right chemicals? Handling postal packages. The government are saying that's pretty reasonably low risk at the moment, but again, just be a little bit more careful. Make sure people are washing their hands after they've handed the post. And social distancing. Can you do more? Can you spread people around the offices where you can't work from home? Can people have different break times from the others? Now, care homes, I've not even tried to summarise the care home guidance, because care homes are obviously very similar to hospitals, and the guidelines are pages and pages long, but there is specific government guidance out there for care homes. We've summarised that in a document which we'll be sharing later with clients, and that document also includes a larger summary of what I've just explained around how to make the place safe while we're working through this problem. And as I said at the beginning of my session here, this is going to be with us long after the next 3 to 6 weeks. We're going to have this this is going to be a situation we have to manage as business owners, managers for the next, it's going to be months rather than weeks. So even when we go back to normal, we still need to be considering these kind of control measures. And I think that's on to Audrey now.
Good morning, everybody. I just wanted to have a kind of a bit of update for anyone who did come last week. We did have a talk about the general ideas of looking after your own mental health and some of the things that you could pass on to your employees to do. I just wanted to expand that a little bit this week and really talk about how in normal times, perhaps we're not very much engaged with the physical and mental health of people we work with who are well. But now is really a time, I think, for business owners and managers to kind of be a bit more proactive about that, take a bit more of a long-term view. With so many people working at home or furloughed or laid off, we need to be thinking about having a team in good shape when they come back to work. And some of that is really about thinking about their mental and physical health now. So I think there are a number of ways you can do this. I think you need to demonstrate perhaps your thoughts about this, maybe by sharing information on your intranet or notice boards. One of the obvious ones is, maybe advising people to moderate their consumption of news media. It's getting increasingly difficult to switch off from that 24/7 coverage. It's not just listening to the news, but it's all anybody talks about. And it might be worth, suggesting that people set aside some time each day to, maybe engage with a hobby or a TV show or something that is different from that. And trying to get some fresh air and exercise, your one trip out a day for most of us. I think it's important not to tell people not to sort of disconnect entirely. People need to be making sure they hear important announcements, but it's just something to bear in mind that maybe you could share with your teams. So yeah, Chris Cassidy, the NASA astronaut, says the main thing you have to do when you're stuck for a long period of time on your own is establish and stick to a routine. For some people that might be just like getting dressed for work rather than sitting in front of a laptop in their pajamas. Finding time and space to exercise, maybe working a different pattern of hours, working out for yourself what it is that you can do, because it might be very different to your normal routine. but it is important to be flexible about that new normal. I think if you've got people working at home, it's important to remember that everybody has a very different experience of that. For some people, it can be actually really difficult. They may even be in risky or difficult situations with relationships. They may not have any real space to work. So it's just about being a bit more open and understanding and flexible with everybody. It's tempting, and we've done it ourselves at More Pay, to say, right, hey everybody, you know, put your video camera on while we're having this conversation. But for some people that feels quite maybe exposing of their home situation. It's the same with keeping in touch. You just need to let people really kind of find their own rhythm for that. I guess for some people, still dressing for work or wearing makeup is something that's important. For other people, they want to feel more of a connect perhaps with their home life and don't do that. So just be a bit wary about imposing one rule fits all for something that you think might work. And it's important to kind of just bear in mind that there is a different rhythm when you work at home. So for you and the people that you work with, you just have to accept you'll have some kind of good hours, some less productive ones. For a lot of people, a daily commute is a kind of effectively a sort of warm up and cool down time. And it's important perhaps to think about whether you need to build that into a daily routine if you're working at home. And of course, there are many social punctuations in the workplace, just making a coffee or whatever, just odd bits of social conversation are very much the norm in a lot of workplaces. So, you know, an idea you could have is perhaps to have an online coffee break now and again, where everybody just chats about their day, perhaps with a coffee, or even a virtual cake day. Hopefully the cake wouldn't be virtual, but for some offices that routine of sharing treats is something that people might be missing, and it's really important to hold on to those sort of social connections. I would like to say, however, just be a bit wary of being relentlessly upbeat. It's obviously really important to stay positive, but people won't trust you or be open with you if you're not acknowledging how overwhelming and difficult the whole situation is. You'd be a little bit more emotionally available, just a little shift from your normal work mode to just acknowledge people's fears and their struggles, and that can really make a big difference of keeping people on board with you. Again, if you've got people coming in to work still, just be mindful that they may have particular anxieties about their travel or about social distancing. They may be having a lot of more difficulty traveling if they normally use public transport. And of course, many people have vulnerable people in their lives that they're supporting or worrying about. And it's good to just keep in touch with people and make sure they're okay about that. So I've ended with the Be Kind hashtag, because I think that's what we have to do, just be kind to each other and just be a bit more mindful. So somebody perhaps you work with, you know, maybe be a little more tolerant than perhaps you normally are, and just be a bit mindful of how you're interacting with people. So it's just a little catch up really about how important it is to take a bit of a longer term view and be a bit more proactive about people's well-being. So Dan, Michelle and Phil, thanks for letting me jump in there.
That's great. Thank you. Thank you, Audrey. Thanks for joining as well. It's been really helpful. For any of those businesses out there, they're looking at how do we go about EAP? What additional support can we give other than what Audrey's mentioned? We at More Pay do have an EAP helpline. So if anybody would like more information or prices on that, if you just put it, and again, I'm asking you to put it in the questions box, but we can take them away and make sure that we work through them. So if anyone's after a bit more support from More Pay, put it in the questions box and we can get someone to send more information out or give you a call on that. So with the rest of the time that we've got, I'm going to go through some Q&As. bear with me a second while I just pull up, because we had some Q&As come through before the webinar. So first question that we've got, where do we stand with offering home working to a staff member with children, but then putting someone else in the same department as furloughed due to limited laptop availability?
Should I take that one, Audrey? Jump in if you think there's anything to add.
No, okay, will do. No, if you take that one, Michelle.
Yeah, this is going to be difficult because if you don't have laptops that are available for everyone, you're going to have to make a decision as a business who is the critical key staff or a skeleton staff to keep the business going from home, and who you furlough. You could put in some kind of basic selection criteria. Whilst there isn't any formal consultation process around furloughing employees, because this is something that's relatively new to the UK, it would be worthwhile thinking about trying to identify who your absolute critical staff are, and ensuring that they can work from home as a priority, and then the staff that are considered kind of secondary to that they can work home. Or if you've got people in the same category of job but you don't have enough laptops, that's when we would probably suggest that you look at some form of selection criteria, but something basic, whether it is skills based, length of service, qualifications based. There are a number of options.
That's great, thank you. Another question we had: if the whole of the business was shut down due to coronavirus, obviously some aspects of the business still had to operate, i.e. financial. How would it work for the furloughed employees who are not allowed to work? Probably
it's
very
the same
similar.
kind. Yeah, it's a very similar question. It's again about looking at who you need as a minimum to keep your business ticking over, even if it's shut down, keeping those employed and making them work from home. And then the remaining staff will be furloughed, which will mean they will be still on your payroll, but won't be expected to attend work.
Okay,
and this is the alternative to the situation. Sorry, it's just the alternative to the situation where without this, these people would have been laid off.
Okay, another question: if someone has to self-isolate due to a family member, can they work from home?
I mean, the answer to that is yes, as long as they are self-isolating and can work from home. If they're well, they're not sick themselves, there's no reason why they can't work.
Okay, thank you. Another question is, what to do if a member has decided to work from home unauthorized and they are a frontline key worker?
I think this would be very dependent on the circumstances, and this would be one where I would seek specialist ER advice. So if you're one of our customers, ring in the advice line. You need to make a decision as a business about who should and should not be working from home, but make sure you stick to the government guidelines. There are people who feel they need to self-isolate because they are concerned about health conditions, who don't necessarily fall into that extremely vulnerable category, but are still concerned, for example, pregnant women. I would suggest that you should speak to the individual, find out exactly what is driving this, see if you can accommodate it. These are very unusual times, and we're going to have to do things that with normal circumstances wouldn't feel right. If they are worried about their own health, then make sure that you get them to speak to their own GP. But I would speak to somebody regarding that specifically, and seek specialist ER advice.
Okay. What do I need to include in a working from home policy?
I'm guessing that one's coming to me first.
Yes.
Yeah, we're coincidentally we're just drafting a new revised working from home policy template that we can make available. It's a mixture between employment law and health and safety, but on the employment law side of it, obviously I'll leave that to Audrey. But on the health and safety side, it's have they got the right equipment? Are we making sure that we've got access, that the equipment we're sending people to work from home with is safe? Are the laptops pat tested, for example? Have they got a keyboard, a monitor, a laptop riser? If this is only a short-term process, we probably don't need to look at desks and chairs, but if that becomes a long-term issue, then we're still in a little bit of a decision-making process on that. The HSE have been very relaxed on how they approach the short-term working process. But the one thing that is key is, as an employer, you are not responsible for making sure that that employer's work house is 100% safe. You have to make sure the equipment you send them is safe, but if they don't have their wiring checked every 10 years, and if the carpets are ripped, that's down to them, not down to you. So it's a little bit, and like I say, we'll have a template which we're just polishing off and updating and refreshing for this situation, and that'll be available soon. Is there anything you want to add on the employment law side? Obviously, Audrey, there's things like tax and what you can and can't claim and things like that.
Yes, I mean, there's quite a few issues around sort of tax and insurance. I think on a basic HR level, the main thing to do is to set clear expectations. If you are prepared to be more flexible, or if you can't be, are there particular times people do need to be specifically working, or are you a bit more open about people working when it suits them? There are discussions around people who are managing childcare now along with their work. It's really important to have a bit of an open dialogue about that and make sure that certain expectations are put into your policy so everyone knows exactly where they stand. I think that's the basic message.
Okay, thank you. Another question. I have an employee with diabetes. Nature of work means she cannot work from home. Can she get a not fit for work note from the GP or something else?
If she is not going to be contacted by the NHS this week as someone who is extremely vulnerable but is concerned about their own well-being and health, then yes, the best thing to do would be for them to seek advice from their GP about the best next steps. And if they do get a medical note, then they would be entitled to SSP.
Okay, another question. Can you alternate furloughed employees between team members?
I'm not sure I'm really clear on the question there.
Yeah, so I think we've had this a few times, sorry, Dan, that where if you have a furloughed employee that you might want to make them furloughed one week and not the next, or that you might want to swap employees in or out. It's a bit of a difficult one, this, at the moment, but the advice that we are taking from everything the government have said is that if a furloughed employee is of that status, then they are not able to work. And if they do work, then that may put the government grant in kind of jeopardy. So we are advising furlough status for employees where they cannot work and you do not have work for them. As we get more clarification on the exact details of the scheme, we will, of course, update our advice if that changes. Anything you want to add, Audrey?
No, I think that just about covers it, Michelle. I mean, you can't be a bit furloughed. I think that's the message, and certainly within a working week, you can't be furloughed for some of it and working normally for the rest. So I would anticipate that you'd extrapolate that into sort of week on, week off working. You're furloughed for a period because there's no work available for you.
That's great. Probably rather than go for one direct question, because we're getting quite a few on the same topic, and we had it on the webinar last week, we gave a bit of an update, but I don't think the government have given any further guidance, but it was around how do businesses claim SSP back from the government. So I don't think there has been any further update, has there? We said last week that there was government guidance around it, but there wasn't any clear instruction. I think this the case is still the same, isn't it?
Yeah, it's similar. So on the government website, there is a section around advice and support for businesses and employers. And on there, one of the things is around claiming back SSP. This is for small businesses under 250 employees, and it allows you to claim SSP back for 2 weeks for illnesses due to the coronavirus. I think the last that we saw on there, which was yesterday, it still says that they are working on the mechanism to allow you to claim this back. And again, as we get the update, we are constantly reviewing all the government guidance and making sure that we stay on top of it and that we interpret it on your behalf as our customers or the prospects that are on here for this webinars. But at the moment, there isn't a clear guidance on how that will be claimed. I imagine it will come soon, though.
Yeah, thank you. And then another one that we're getting we've had quite a few questions on it is around what is it more pay are doing, and it's probably more from a payroll side of things around identifying employees who are furloughed in our system. I think what we are doing is, as the legislation comes through, we've got a development team that are working throughout the day and night to ensure that we get a fix, and we will during this week communicating to all our customers around the updates we're putting in, when we're putting them in, and how it will work. So although I've not answered all of the questions on it, they're all very similar in terms of what you're asking. So hopefully that's answered that one. I think we've probably, in terms of time, we'll go for one more question, and then all the others, what we will do is we'll ensure that someone does come back to you via email with an answer to your question. So the last question we'll go with is, if employees' contracts don't include a layoff clause, how much consultation is required?
I think that's one that, so sorry, go on, Audrey, I'll let you go.
No, I was just going to say we're a bit in uncharted waters here, I think, to some extent, in terms of what the end result would be. I mean, I would always say consult as much as you can and get any changes that you want to make to somebody's work or frequency of pay, etc., or rate of pay, get them to agree to it. But how that would be viewed later on by courts and tribunals, if it ever came to that, we don't know. We assume that there would be some flexibility in these unknown times, but we don't really know for sure. I mean, would you agree, Michelle? Just do as much as you can, really.
Yeah, I would. You know, given that the government are imposing closures of businesses at quite short notice, there isn't the time to do normal, meaningful consultation, which you would expect around something like a redundancy. What we would suggest, though, as Audrey said, is making sure that you communicate to your staff what your intentions are, and then when you're following up with a letter, so if you are changing their worker status to furloughed workers, it's unlikely you will have a specific clause that references that. You may or may not have the layoff clause, but it would be wise to use a template which asks them to accept it. But if you're very clear with them that the alternative to this is either being laid off or being made redundant, and you are doing everything you can to avoid that, you are clear and you document and you ask for their acceptance, and you communicate with them. I think all we can do at the moment is advise our customers to be sensible, and we would hope that tribunals would look at it with a sensible angle in months to come.
Okay, that's great. All right, I think that's all for all we've got time for in terms of questions. As I mentioned, we'll get back to everyone who hasn't had their question answered. Just as in terms of just closing out, hopefully you can see my screen. I've just opened up our website, and at the top of our website we've got this knowledge centre. If you click into there, we have got a topic, COVID-19, but this is where we put all our free resources, guides, downloads. If you click into the COVID-19, you'll see that we're doing blogs, getting to a point where it's now nearly on a daily basis. We're putting free company guidance on their guides. You can view all our extra webinars that we're putting on. If anybody is a bit unsure, feel free to visit this section. You might find something really useful in terms of what you're looking for. And it's not just COVID-19, it's all other types of topics in there. So if you are unsure, please feel free to jump on our website and have a look around. So anybody, as we've gone through today, anybody that is interested in a bit more information, whether it be a customer who hasn't got an additional service that we mentioned, or it be a prospect that's looking to have a bit more help and guidance, we offer obviously a 24-hour 7 days a week advice line where you can pick up the phone and speak to our experts, both from a HR and health and safety point of view. We have payroll software. You can outsource your payroll. We're all operational with our payroll. It's all cloud-based. Anybody that's got any or would like any further information or any pricing or proposals sent out, please put it in the questions box, and I'll ensure that someone gets back to you with a bit more information. Next week, we're going to put on another webinar. We might make it slightly longer next time. And during the course of the webinar, we'll go through a bit more around what MorePay are doing to support businesses, both from a payroll point of view to ensure that their workforce are paid and they're paid correctly, and then also what we're doing and how we can support you from a HR point of view. The last 4 weeks we've been through COVID-19 and the issues and challenges businesses are facing. We just wanted to spend probably, it'll be about 20 minutes just going through what it is MorePay are doing to support you as a business. So with that, I'd like to thank you for joining, and hopefully see you all next week as well. Thank you. Bye-bye.